Hi, I'm Dr Amy Pearson and I am the Programme Director for the Masters in Neurodiversity and Development and the Masters in Research Methods for Developmental Psychology. My own work focuses on understanding the relationship between stigma, identity and victimisation among autistic people. Stigma involves the experience of other people judging your identity to be spoiled in some manner and being judged negatively by others for being different. Autistic people experience stigma at the group level because of negative stereotypes that non-autistic people hold about them, for example, thinking that autistic people lack empathy. But autistic people also experience stigma at the individual level for failing to meet normative expectations of how a person should act and communicate. This experience of stigma contributes towards autistic masking. Masking, which is sometimes referred to as camouflaging or adaptive morphing, describes the experience of suppressing aspects of identity or projecting a non-authentic version of yourself to others. Autistic people have described engaging in masking in order to fit in social situations and avoid being negatively judged by other people. A study I conducted in 2021 explored the experience of masking among autistic and non-autistic people. And there were some similarities in the kind of strategies that people would use to try and blend in social situations. There were also some specific things that autistic people talked about as being key aspects of masking for them, like suppressing sensory distress or not engaging in repetitive body movements, sometimes called stimming, to avoid being made fun of or judged by others. The experience of stigma also leads to a higher risk of experiencing violence from other people. Autistic people are more likely to experience something called interpersonal victimization, and that is violence and abuse from people you know, which contributes towards poor mental health outcomes among autistic people. Over the past few years, I've been interviewing autistic people about their experiences of victimization to see what we can do to provide better support for autistic people who have experienced violence and abuse. One thing that really helped people was having the right words to describe their experiences. This is called hermeneutical justice. People just need to have access to the concepts to help them make sense of what has happened to them. Learning about things like coercive control or widening their understanding of what autism is help people to make sense of their experiences and to start to heal. And that healing process was facilitated by professionals with an up-to-date knowledge of neurodiversity and who are compassionate and person-centered in their approach. Lots of the people that we spoke to had had bad experiences with therapists and with the police who felt that they didn't know how to respond to or support autistic people. One of our participants, Rachel, told us about some bad experiences with a psychologist and how she didn't feel very understood, which caused her mental health to become worse. By conducting research like this, we can help to understand how to improve outcomes for neurodivergent people through things like emphasising the need for better training for professionals and working to ensure that places like school are safe and supportive of varying needs. I'm part of the Centre for Neurodiversity and Development. If you'd like to hear more about our work and our courses, you can visit our website to learn more.